I'm Professor David Ralph. I work in London at the University College. A lot of doctors would be pleasant and show empathy to the patients anyway, but there were a lot that didn't. The junior doctors will only emulate what the senior doctors are doing. So if you have some senior doctors which actually are quite compassionate to the patients, then hopefully that will rub off on the juniors.
And the other thing I was very touched when I was in your OR or your colleagues' OR, they were treating the patient as they should be. What I'm saying is that they didn't strain the patient, and they were treating them, how I say it, like the human beings, as the human beings. You know, when they are anesthesia, well, when they get a, general anesthesia or on the surgery table, we sometimes treat them like an object, but you were not. You were treating them as they should be. When that started?
Well, I mean, obviously when I was in training, then there's a higher, your chief, you could hardly speak to your chief because he was so powerful. And, that sort of mentality has changed in the United Kingdom, in that we're a little bit more equal, and I think we're taught as well to respect the patient, and certainly the government is saying that patients have rights and they can make complaints and they need to be treated, etc. And I think that's good. I mean, a lot of doctors would be pleasant and show empathy to the patients anyway, but there were a lot that didn't. But those that didn't have been forced to do that. So, and of course, again, remember, it's training. So the junior doctors will only emulate what the senior doctors are doing. So if you have some senior doctors which actually are quite compassionate to the patients, then hopefully that will rub off on the juniors.
I mean, that's what I saw. You were exactly reproducing what you are doing with your colleagues. So like Mr. Christopher and the other surgeons will be able to. And the other part I was able to feel was more like my own personal point of view is that Australia, Germany, and Saudi Arabia, and many other countries are affected, and they are offsprings of your trainings. So they get trained in the UK to be an andrologist, go back to Australia.
It's fantastic to have, because as I said, we have 8 fellows, we have huge numbers of observers that come from all over the world. But the fellows are there to be trained, and we always make sure that we've got overseas fellows, because we don't need to train 8 fellows every year in the UK because there aren't so many posts for them. But we still have the work, and so we get fellows from the United States, Australia, Europe, and it's nice because they then see a different way of doing things. They go back to their country, and it feels great when you see that your fellow is presenting some papers, and they'll say, well, when I was in London I was told to do this, and then it makes it all worthwhile because they appreciate their time with us, and we appreciate them.
What will be the future direction you want to go?
Well, I mean, there's only so long that I can be taking things forwards, and the most important thing is leaving a legacy behind so that you can say that's what I've achieved. And the most important thing is that we have the biggest andrology unit in the world, and we do have the biggest andrology unit in the world. And I've talked about just the consultant surgeons and the junior doctors, but of course remember, attached to all of that we have 3 andrologists, so urologists that do all of our embolizations and MRIs, etc. We have the embryology staff that come with us, psychosexual therapists, and the pathologists. So it's not just the people it's all those in the periphery as well. So it's a big unit, and I hope, I'm sure it will stay that way. hey, medicine changes. They only have to develop some new drugs and then put us out of business, I guess. But until that time, hopefully we can offer a service.
Yeah.